experienced a large outbreak with over 500 suspected cases and over 200 confirmed cases, and a case fatality ratio of approximately 3%, which means that of the persons, let's say 100 persons are infected, 3 of them die. Okay, that when we talk about fatality ratio, this is what we're referring to. So cases continue to be reported until today. So in Nigeria, they still have ongoing cases daily. Monkeypox is a disease of global public health importance. Do you wonder why? As it not only affects countries in West and Central Africa, but the rest of the world. So something becomes of global importance, public health importance, when we start to see it in the USA, or we start to see it in the UK, then all of a sudden, it becomes very, very, very important. Sad to say, but it is true. But this has been going on in Africa all the time, but it wasn't really that important. So in 2003, the first monkeypox outbreak outside of Africa was in the United States of America and was linked to contact with infected pet prairie dogs. And these pets had been housed with Gambian poached rats and dormice that had been imported into the country from Ghana. So in other words, it came in, and I would have done a presentation before when I told you how a lot of the transmission of a lot of these pandemics and stuff were transmitted through animals, rats and grain and all types of things coming from one country to the other. So this was a similar situation. And this outbreak led to over 70 cases of monkeypox in the US. And monkeypox has also been reported in travelers from Nigeria to Israel in September 2018, and to the United Kingdom in September 2018, and December 2019, and in May 2021, and now again in May 2022. And to Singapore in May 2019, and to the United States of America in July and November 2021. So we saw transportation from one country to the other in these particular periods. In May 2022, multiple cases of monkeypox were identified in several non-endemic countries, and studies are currently underway to further understand the epidemiology and the sources of these infections. Actually, some of those cases, persons had never traveled outside of the US or outside of the UK. So that's why they're trying now to research to see what is the pattern of transmission. All right, because there's no link to travel. I mean, there must be probably some, but it's just that they're not seeing it. They're not seeing that link. So here, if you glance briefly at these maps, you don't have to look in detail, but if we look to see some of the first cases were on the 7th of May, when a patient had recent travel history from Nigeria, which is where they're believed to have contracted the infection. All right, and then there were 2 cases on the 14th of May, of monkeypox identified in London. And then on the 23rd of May, there were actually 36 additional cases in England, and 1 in Scotland. And then 11 additional cases confirmed in England on the 20th of May. And then 2 more cases on the 18th of May. And then a further 4 cases on the 16th of May. So you see that just like how the coronavirus started with just a few cases and then spread, and that is why we need to make sure that we keep following up on this and that we have the information so we can see the spread, that when it becomes now a pandemic, then you would know, because there are a number of different countries that it has spread to already. So transmission, how is it transmitted? And I think this is important for us to know in case it reaches our shores and we would know how it is transmitted and therefore how to avoid that transmission. So the monkeypox virus enters through, just like most other viruses, through the mouth, through the nose, and through the eyes. But most importantly, it enters through the skin, because remember, they're pox. So if they touch the pox and they're broken, or even if they're not broken, the scab is rubbing off, even if they're not visible, you can actually get it through the skin, through the respiratory tract, and through, as I mentioned, the mucous membranes like eyes, nose, and mouth. So you can contact with an infected animal or human. So most of the time, you probably wouldn't know if the animal is infected. You might know if the human is infected, depends on which stage the infection is at. And I'm going to mention that there are different stages of the infection. So it might be that the person originally have a respiratory infection. So they're sneezing, they might be coughing, etc. And you're not seeing anything more than that. So you don't really know that they have monkeypox, but then later on, then they start to develop the pox. So it can also be spread by respiratory droplets. Hence, the importance of wearing masks, the importance of keeping your distance. Beginning to sound familiar? Yes. And then it's also spread by lesions, skin contact through broken skin, bodily fluids, mucous membranes, contaminated materials like bedding and clothing. Remember, I had done something on Leviticus where it was saying if the bedding and the clothing are soiled, to make sure it can wash or you actually burn it. So in the early days in Barbados and throughout the Caribbean, when we had lots of smallpox, that is what had to happen. And then fomites, which is like surfaces. Right now, even with COVID, you can pick up the virus from surfaces. So similarly with this monkeypox. So monkeypox is an infectious disease that is transmitted from animals to humans. However, when a person comes in contact with another human or materials contaminated with a virus, it can also be transmitted. So that is being reinforced. And transmission, again, the longest documented chain of transmission in a community has risen in recent years to 6 to 9 successive person-to-person infections. In other words, you're not just going to infect one person, but you can actually, infect up to 9 people because it started with you and then the next person, right up to 9 persons. And this may reflect declining immunity in all communities due to the stoppage of the smallpox vaccination. Now, remember when we were small, those of you over 50 would remember, we had a smallpox vaccination. If you look at probably your left hand, because most of the time they give you the vaccination in your non-dominant hand. So if you're right-handed, most of the time you get it in your left hand. All right. And you can actually probably still see it there. I'm going to show you a picture of it so you know what you're looking for. The transmission can also occur via the placenta. So if you're a mother and you're pregnant and you're delivering your baby and you're not vaccinated, then you can also spread it, the monkeypox, to your child. Okay. And it is unclear at this time if monkeypox can be transmitted specifically through sexual transmission routes. And the reason why that is there is because in Canada, they actually found a cluster of monkeypox in a homosexual community. And persons even started texting me and asked me if it's a homosexual disease. Now remember HIV? Everybody was saying HIV is a homosexual disease until a lot of married people and a lot of straight people, etc., started to be infected with HIV. And then they realized, no, it's not really a homosexual disease. And what we're seeing now with the monkeypox is because You have to touch during sexual intercourse. I can't imagine that you can be keeping 3 feet and having sex, but you know, you never know. But the case is that you have to touch the person. So you really can't tell if it is sexually transmitted or not. What you can tell is that anytime there is any touching, then it will spread, right? So studies are still ongoing to see if direct body fluids can also cause transmission. So here, just to give you a kind of overview here, how it spreads. Primarily animals, typically rodents, like rats, but monkeys as well, through bites, through scratches, and probably why we are seeing so many cases in Africa is because consumption of bush meat. So that is also another avenue of spread. And then it's also spread from human to human transmission through close contact, touching, or through respiratory contact, okay? And symptoms, and I'm going to go over the symptoms, realize that I am reinforcing as I continue, as I go on. Intense headache you can get. You can also get a fever, and this is almost always a must, a fever. You can get swollen lymph nodes, backache. You can get chills, exhaustion, feeling really tired. And then you can also develop a rash. And that comes a little later, as you will see from another slide. But the illness can last between 2 to 3 weeks, 2 to 4 weeks. So you're really sick in bed, basically. So let's go over again the clinical features, the symptoms: fever, headache, backache, swollen lymph nodes, chills, exhaustion, and then the skin rash usually comes like 3 days after the fever. So you don't get the rash immediately. The rash comes a little later. All right, and monkeypox symptoms from 2 to 4 weeks. Some people say 2 to 3, some say 2 to 4 weeks. So how long before you know if you have monkeypox? The incubation period is pretty long. It's actually between 6 to 13 days, and it can be up to 21 days. Now, remember with COVID, at first we were saying the incubation can be between 2 to 14 days, but they realized that most persons become infected between 3 and 5 days. But you still give that long period because there are some persons who might be resisting, building up immunity, etc., and then eventually succumb to it, right? And you can still get it. So this can happen in this case, that up to 21 days you can be battling and incubating this virus and then eventually get it. So that says a lot about travel, because right now it is in the UK and it is in the US. So we can have relatives, we can have people who might be incubating it, who might come, and you're not seeing any signs at all because they're incubating it. But then when they actually get here, then they start to develop some symptoms. So let's look at the disease a bit more. Monkeypox is usually a self-limiting disease with the symptoms lasting 2 to 4 weeks. Now, most viruses are self-limiting. There's no real cure for a virus. That is why vaccination is so important. And we take that for granted. But there is no real cure for a virus. It has to limit itself until it's finished and then it disappears. So it is all about our immunity and being vaccinated. Okay, so severe cases occur more commonly among children and are related to the extent of the virus exposure. This is another thing about viruses. If you're exposed to a lot of the virus, then you can become a lot more sick. If you're exposed to a small amount, you might still become sick, but not to the extent that the person that is exposed to a lot of it, right? So patient health status and the nature of the complications, all of this plays a part. And as I mentioned to you, and I think we're going to, oh yeah, we're going to get to that. So the underlying immune deficiencies may lead to worse outcomes. So just as we saw with COVID, the persons that are diabetic, the persons that are obese, etc. So when you have underlying conditions, then you're always worse off. That is why we keep pushing for you to have a good immune system that you can fight off all of these things. So although vaccination against smallpox was protective in the past, remember today, the younger people, persons below 50 years old, would not have received because we eradicated smallpox in 1980. So then there was no need to be given, if it's already eradicated, there was no need to be giving persons a smallpox vaccine. So that is why those persons are a lot more at risk now for the monkeypox. So complications of the monkeypox can include secondary infections like bronchopneumonia, sepsis, encephalitis, which is inflammation of the brain, infection of the eyes. It can actually lead to blindness, loss of vision. And we saw all of these things with smallpox. So this disease is pretty much close, very close, mimicking smallpox, but it is not as infectious and it's not as deadly as smallpox. So it's actually a lot milder. But it doesn't mean that one or two persons can die, as you will see shortly. So the extent to which symptomatic infection may occur is unknown. But the case fatality ratio, and as I mentioned that to you before, it means the percentage of persons that will die from the disease, all right? That is between 0 and 11%. So 1 in 10 people can die from monkeypox based on some of the studies in Africa. But then remember that there are 2 different clades. So one clade is more deadly than the other clade. So in recent times, the case fatality ratio has been around 3 to 6%. And also with better health care, then you would see less deaths in any area, because you tend to treat the symptoms, build the immune system, etc. So treatment. So currently there is no proven safe treatment for monkeypox. And as I mentioned, really for no virus. All right, we just try to treat the symptoms as much as possible. So for purposes of controlling a monkeypox outbreak, the smallpox vaccine and then the antivirals are used. So clinical care for monkeypox should be fully optimized to alleviate symptoms. So in other words, you treat whatever symptoms. If you have a headache, if you have a fever, whatever you have, you try to treat those symptoms. You try to manage the complications. And then patients should be offered fluids and, as I mentioned, foods to boost your immune system. So good nutritional foods. And then there's secondary bacterial infections. Those should be treated. And bacterial infections can be treated with antibiotics. An antiviral agent known as tecovirimat that was developed for smallpox was licensed by the European Medicines Agency, EMA, from monkeypox in 2022. That is this year. But notice that it is still not widely used yet. So let's look at vaccination a little bit. And if you can look at the top right, you can actually see the smallpox scar. It has like a little crater on your hand. I actually saw mine. I can see mine right now. So if you look, you might be able, if you're over 50, that is, you might be able to see yours. So you don't mix it up with the BCG, they actually put both together. So you can see the BCG one might got just a little hump, while the smallpox one is like kind of a rough edges going around, like and a descent, like a crater. So you can actually see if you had a smallpox vaccine. But I think everybody over 50 should have one, because at that time it was mandatory for you to go to school for you to have that smallpox vaccine. So the term vaccine was first described in the 18th century by Edward Jenner, and is derived from vacca, which is the Latin word for cow. So Edward Jenner, they had cowpox at the time. Just like how there's monkeypox, there was cowpox, which was milder than the smallpox. So Jenner, he inoculated an 8-year-old boy with cowpox lesions from the hands of milkmaids in 1796. So in other words, the milkmaids would have gotten, you could almost say, immunity without getting any treatment or anything. So he knew that they were dealing with the cows all the time, and he just got, from their hands and put it on the boy's cowpox, and he was able to vaccinate, and that worked for the boy. So later on, persons took that information, built on it, and developed a smallpox vaccine. So vaccination against smallpox was demonstrated through several observational studies to be about 85% effective for preventing monkeypox. But remember, we don't have smallpox vaccines right now. They're probably very, very little. So if you think that you could rush and get one, it really don't happen like that. So what they would do is probably reserve it for healthcare workers, the little that they might have, that would have to be treating and working with monkeypox. So prior smallpox vaccination may result in milder illness. It doesn't mean that you can't get monkeypox, but it means that you either would not get it, or if you do get it, you will have a milder illness. So evidence of prior vaccination against smallpox can usually be found. And as I mentioned, the scar is right there. The original or first generation smallpox vaccines are no longer available in the general public. And some laboratory personnel or healthcare workers may have received a more recent smallpox vaccine to protect them when they're caring for other people, right? A still newer vaccine based on a modified attenuated vaccinovirus, the Ankara strain, was provided for the prevention of monkeypox in 2019. So we have to see if they're going to be developing more of that. And this is a 2-dose vaccine, like similar to the vaccines that we have now, the Pfizer and those different vaccines. Those are 2 doses. And smallpox and monkeypox vaccines are developed in formulations based on the vaccinovirus due to a cross protection afforded by the immune response and the orthopox virus. Now, when you get a vaccine, your immune response has a lot to do with it. People figure, oh, you put in this in my body, you put in next. But no, it is your body. When the vaccine gets into your body, it's your immune response that does the rest. So really and truly, persons are misguided. So the new monkeypox cases, and I just have 20 slides, so I should finish on time and give you time for questions. The identification in May 2022 of clusters of monkeypox cases in several and remember I explained what is non-endemic countries where you don't see it all the time and it comes into that country, that's considered a non-endemic. So that's like the USA, that's like the UK, those European countries, those are considered as non-endemic. Further investigations are still ongoing to determine the likely source of infection and to limit the further onward spread. Now, we don't want this particular monkeypox to become a pandemic. Right now, it is an outbreak, which means that it has reached epidemic proportions in some areas, but it hasn't spread to enough countries to become a pandemic just yet. So it's being monitored. So as the source of this outbreak is being investigated, it is important to look at all possible modes of transmission in order to safeguard public health. So, and this is more for governments to do, reducing the risk of zoonotic transmission and preventing monkeypox through restrictions on animal trade. But then what is your take? What do you have to do? There are certain things like wearing masks, keeping your distance, washing your hands, all of these things that you learned during COVID, you have to continue doing. So how monkeypox relates to smallpox? The clinical presentation of the monkeypox resembles that of smallpox. They're very, very similar. I think the only thing that was identified as slightly different is the lymph nodes, the swollen lymph nodes. But apart from that, almost everything is pretty much the same. And the smallpox was more easily transmitted and more often fatal, as about 30% of patients died. So in those early days, we had lots of deaths from smallpox. And I would venture to say that a lot of those deaths would have come because they were slaves, or if they were not slaves at the time, they had just moved out of slavery. So the hygiene conditions were extremely poor. So they really couldn't succumb to, they really couldn't overcome the smallpox because of the poor conditions in Barbados at the time and throughout the Caribbean. And the last case of naturally acquired smallpox occurred in 1977, and in 1980, smallpox was declared to have been eradicated worldwide after a global campaign. I noticed a campaign of what? Campaign of vaccination. And I'm going to give you an example of a history of that in Barbados. So it has been over 40 or 50 years since all countries ceased routine smallpox vaccination with the vaccinia-based vaccines. So as vaccination also protected against monkeypox in West and Central Africa, unvaccinated populations are now also more susceptible to the monkeypox virus infection. Okay, so therefore now there's no protection. If you're over 50, you still have some protection. So where smallpox no longer occurs naturally, the global health sector remains vigilant in the event that it would reappear through natural mechanisms, laboratory accident, and deliberate release. Just to explain this to you. Now, I don't know why humans are like this, but everybody wants to store their own smallpox. So you would find that in the USA, there's a level 5 laboratory where smallpox is stored. And you would find that in Russia, they have their smallpox stored. You would find that in UK, they have theirs, and they have it under lock and key, yes, but they can also use it for bioterrorism. So in other words, if Russia now decides that they want to use the smallpox to get to Ukraine, they can pretty much do that. They have this smallpox that they can unleash. So that is why this is so important. So to ensure global preparedness in the event of re-emergence of smallpox, newer vaccines, diagnostics, and antiviral agents are being developed. Obviously, these can be developed fast enough, but scientists are always working on something. And these may also now prove useful for prevention and control of monkeypox. So just to tell you a little bit about smallpox, very briefly, smallpox was caused by one of two virus variants, the variola major and minor, and the origin of smallpox, like all of them, are unknown, but it was from as early as the Egyptian mummy time. And the symptoms, very similar: fever, vomiting, skin rash, and bumps. And the transmission was again through droplet, airborne, contaminated objects, as we saw, beddings, the sores on people's skin. And in the 18th century, Europe estimated over 400,000 people per year died from the disease. And there were actually 3 kings that died from smallpox. And a third of the actual cases of persons who didn't die became blind. And we saw the same blindness with the monkeypox. And 300 million people in the 20th century and 500 million people in the last 100 years would have died from smallpox before it was eradicated. And the last naturally occurring, I think this was mentioned, was in October 1977. And in 1967, there were 15 million cases. And at that stage, that is when the World Health Organization started to intensify their vaccination efforts. And by 1980, they were able to eradicate smallpox. So if persons didn't take the vaccine, right now we might still have smallpox. All right, and coming to the end, you can see two little boys there. One is vaccinated, one not. So one have smallpox, the other one doesn't. That is how important it was at the time. So it was one of the deadliest and most contagious diseases known to humankind. And the smallpox killed over 500 million people in the 20th century alone, and 3 times the number of deaths from the wars that were taking place. And it began with flu-like symptoms, as I mentioned, similar with monkeypox, progressing to an horrendous rash. Remember, the rash came after the fever, consisting of deep sores filled with fluid that would blister and ooze, and then the crust would scab off and leaving permanent scars on those lucky to survive. All right, but most of you might know the story of George Washington when he came with his half-brother Lawrence to Barbados. And this was in 1751. And his half-brother actually had TB, and he was bringing him to a tropical country, Barbados, to enjoy the sea and the sun and to recuperate, get better. And at that time, the minute he got here, there was some relative called Gedway Clark, who was an uncle of Lawrence's wife, visited them and invited them over to his house. So George Washington was very skeptical. He didn't want to go because Mrs. Clark had smallpox. So he was saying, no, I won't go, I'm not gonna go. And then eventually he decided, you know what, I will go. So he went, and in 2 weeks' time, he contracted smallpox. He was 19 years old, George Washington, at that time when he got smallpox. But he fought it off, probably his immune system and his care and everything. So he was able to live, and he went back to the USA. As we know, George Washington became one of the presidents of the USA. But then he was in the military, and there was a war between US and the UK. And there was also a bigger war with the smallpox, killing out all the soldiers, both in the UK and in the US. And George Washington, having gone through that smallpox, decided that he would take the crude vaccine and give it to all of his soldiers. And that is how he was able to win the war, because they were vaccinated, they were able to withstand the smallpox and be able to fight and win the war. Now, Crofton's house is just where he spent most of his time. So, and vaccine hesitancy didn't come with the coronavirus. It was here a long time ago. So in February, just to give an example, in February 1902, there was an outbreak of smallpox in the island. And this really tested the Barbados health authorities. And really and truly, there was a patient who they called patient 0 for that particular outbreak, who was ill during his voyage to the island from Halifax. He was coming in from Canada. And he had, upon his arrival on the island on the 20th of February, he visited some friends in Chelsea Lane near the garrison. And he became extremely ill to death. And he was seen by the port health doctor, and he was diagnosed with smallpox. So by the 23rd of February, 1902, he was placed in an isolation on Pelican Island. Now, we don't know anything about Pelican Island because they just joined up everything, right? But Pelican Island became the isolation unit, just like how the Harrison's Point is the isolation unit now. Pelican Island became the isolation unit. But sad to say that this guy died after 2 days from the smallpox. But then the smallpox began to spread rampant throughout Barbados. So they started building temporary hospitals, but persons did not want to get vaccinated, did not want to be isolated. So persons start running from Bridgetown to St. Lucie and St. Peter and St. Andrew and all over to avoid being vaccinated. So, you know, so they were hiding. But then when the increased illness came and they saw the increased deaths, they forget all about that hiding and all of them went and got vaccinated. So about 76% of the population then got vaccinated. But you know what they actually did? Let me see if I have it on another slide. No. So what they actually did was the government paid them 6 pence to get vaccinated or to get revaccinated. And persons took up that 6 pence and went and got vaccinated. A lot of poor people were around the place and they got vaccinated. So it was a stage where there were actually 778 cases, and out of those, 704 had not been vaccinated. So persons saw the direct link between the unvaccinated and getting the smallpox. In 1902, there were actually 103,000 persons vaccinated. After the incentives, there were about 150,000 being vaccinated. And then eventually the epidemic or the outbreak was cleared in 1903 after enough persons became vaccinated. So my last two slides is prevention. So we need to raise awareness of the risk factors, and we need to educate people about the measures they can take to reduce the exposure to the virus in the main prevention strategy for monkeypox. And not only for monkeypox, but for any virus. Right now, we have a lot of COVID in Barbados still. It's just that a lot of people not going to get tested, that's all. But you know people that are positive and that becoming positive every day. And we need to be educated and we need to know how to prevent contracting it. All right. In terms of wearing your mask, keeping your distance, doing certain things, you need to practice all these. At time to time, you let your guard down, but you know, you need to practice those. So scientific studies are now on the way to assess the feasibility and appropriateness of vaccination for the monkeypox. Now, I don't think it's going to be mass vaccination, but it's going to be specific vaccination to healthcare workers, to persons who were caring and stuff like that, persons in homes and stuff. So some countries have or are developing policies to offer a vaccine to persons who may be at risk, such as the laboratory personnel and rapid response teams and health workers. And lastly, avoid coming into contact with people recently diagnosed with the virus or those who may have become infected. So if you know that somebody was diagnosed with monkeypox, you don't need to come in contact with them. Unfortunately, somebody might have to care for them if they're ill in bed, but then you wear your PPE, you're fully clad, you're fully masked, you have your gloves, everything, if you have to care for that person. So you wear your mask, and if you're in close contact with someone who has symptoms, you use condoms, and this is not a surety, but they tell you up front if you're sexually active, because you don't know how it is spread. But in terms of persons who have the pox, I mean, you keep your distance. So you avoid coming into contact with animals that could be carrying the virus. And these include sick or dead animals. If you see an animal looking sickly or, you know, dead animals that you think it can be transmitted through, you keep your distance. And particularly those in the history of infection, like the monkeys, the rodents. And we have lots and lots of monkeys in Barbados, so I hope it doesn't come here, because we'll be in trouble anyway. But they're saying that they're not sure of the green monkey, but I mean, anything can be a reservoir. So practice good hand hygiene. This is important. Wash your hands, wash your hands, wash your hands, especially after coming in contact with infected or suspected infected animals or humans. And I wouldn't even add in those parts. I would say that you need to be washing your hands with soap and water or using an alcohol-based hand sanitizer on a regular basis. and use personal protective equipment if you have to care for a patient who has monkeypox. Now, the vegetarian diet is ideal. And for those people in Africa and stuff, they would tell you only eat cooked meat that is cooked thoroughly. We would recommend that you use a vegetarian diet and that you make sure that you use your supplements, you use your natural herbs from the garden, but you try to boost your immune system. And it is your immune system that would determine a lot of response to illness. So that is important. So I'm going to stop there. And if we have time, I would allow you to ask a few questions. Are there any questions? Is exactly 5 o'clock? So just make it short and quick.
Yes, go ahead. No problem at all. Thank you very much. Based on what you were saying about the monkeypox and the smallpox, these particular viruses that are extremely deleterious to the skin, I'm just asking, what about any super viruses that may come about, say, about plague 1 in terms of a vaccine for that? Is it possible that we can have a vaccine for the saints? Thank you.
I ain't sure if I understood exactly what you're asking, but vaccines can be developed for anything, but I would encourage the saints to take a vaccine. Right now, we have vaccines for coronavirus, and a lot of our saints ain't taking the vaccines. So
I got my booster actually this week, Tuesday. So I thank God and I thank you very much.
I think persons need to be educated enough to know it's a personal choice, yes, but they need to understand that it is not something that is going to harm you. It's something that is going to benefit you. All right. So right now, the coronavirus is not, as deadly as smallpox was. So therefore, a lot of persons can get away with it now. But if we were to have, as you're saying, Kamal, something deadly coming on the market, then persons will lose their lives unnecessarily. So I just want to say that, but really and truly, it's your personal choice, and I'm not taking away that choice from you. But I am just warning persons that we don't know what is in store in the future. So you need to really understand that, vaccines are not there to harm you.
Thank you very much indeed.
Again. Thank you. Oswald Newton, that hand from that house, go ahead.
Yes, in connection with the 7 last plagues, the saints, when I'm not trying to deny the vaccine advice for these times, but in terms of the 7 last plagues, the saints are to put their trust in God, because at that time, the saints wouldn't be looking to get vaccinated against any of the plagues, like the boils and so on and so forth. Even at that time, I'm not sure if any part of the world or any of the scientists in the world be able to get a vaccine against that. So the saints at this time are to begin developing faith so that we can be, and the word of God promises us that once we are fully in Christ, we will be protected from the scourges that come upon the world. So no need to be looking for a vaccine for the saints. The vaccine for the saints is the faith now that will protect us in the time of trouble.
All right, I heard your comment, but I totally disagree with you. We need to have faith in Christ, yes, but Christ has also given us knowledge and wisdom that we will understand what to do, just like how to eat. He has given us that information as to what we should eat and how we should live, how we should practice good hygiene. If you did the Bible year, you read Leviticus, and messages were given to the Israelites from as early as the Bible days as to how they should practice good hygiene. Even in terms of the bed linen, they were told that if it was soiled, they should burn it. They were told how they should remain outside of the court for certain diseases, so that advice has been given throughout history. And I would like to say that, God is leading us, giving us knowledge and wisdom. It is for us to hear when we need to execute that and what we need to do at certain times. And I'm not saying to you that you shouldn't have faith. Of course, you have to have faith, and that is very, very important.
Yeah,
Jay.
Okay, sorry.
CJ.
Yeah, sorry. I don't know if you understood what Brother Ozzy said, but Brother Ozzy, he is right, because the plagues will be falling on those who have not had the seal of God. And regardless of, they are the ones who are sealed, and they would not receive of those plagues, because the Bible said that they would be protected. So that's where we have to place our faith in God.
Yes, but do you notice he did not say that? So don't say something that he did not say.
From what he was saying. So
yeah, no, he said
Okay.
You have faith, and I agree that you have faith, but he's not saying that the plagues will not fall on them. So if the plagues don't fall on you, you're fine. But all I'm saying is don't link that time to now. Now you're given knowledge and wisdom, and you need to use that knowledge and wisdom. We will see when that time comes with the plagues, and we will know, and we will be guided, and we will be directed as to what we should do at that time. Right now, we should be also guided as to what we should do now. And I'm not saying that I am forcing anyone to do anything. It's an individual decision that you would have to make, but don't make the vaccine to seem as though it is a bad thing. That's what I'm saying. But you can determine if you want it or you don't want it. All right, ready, me. Let's hear from you. No, 11. We have short time. We're giving different persons. We don't want any back and forth. We're giving different persons opportunity to make their point. Go ahead.
Good afternoon.
Good afternoon.
Recently, our immune systems, those of us who took that vaccination, or vaccine, should I say, for the coronavirus, they said that too much of anything is not good. Can we should I say, boost our immune system?
You're right in saying that too much of anything is not good. But I don't think persons would allow you to overboost, because what is actually happening is when your immunity starts waning, which is after the 4-month, 6-month period, then there's nothing to overboost because it's already waning. So if you go and take a booster, that is totally fine. And that is up to you. What they're seeing now, which we weren't hearing before, is that natural immunity is even better than the vaccine. And I kept saying that all the time, even though the scientists didn't come up with it yet. But we've known from throughout all science that when you get a disease naturally, then it protects you more than any vaccine. And now they're seeing that natural immunity that you would get from COVID helps to protect you from getting COVID again. At first, they were saying, oh, it's only going to last a few weeks, it's only going to last a short time, but it's actually working better than the actual vaccine. So that is it. But all I'm saying to you, Brother Kelman, is that persons would not allow you to overboost, because you shouldn't really go and get it too often. If your immunity wanes in 6 months and you get it, you would not be overboost, because that means that the immunity has waned. And there are records to show when you had your first one and when you can get the second one, etc. So I don't think that will be an issue. Brother Dowridge. You have to unmute. I can't hear you. And then after Brother Dowridge, we have one last one that we wouldn't encroach on the other section. Brother Dowridge?
Okay. I noticed a little bit of bias earlier when you mentioned that we were talking about stockpiles of these things that some governments store you hinted that Russia could possibly use it in Ukraine. I'm wondering if you also consider that the US has done something similar and could possibly do the same as well.
I said so.
Because-
Remember, I said US, I said UK, I said Russia, but right now that's the only war that I know about going on. So that is why I mentioned that. But US could do the same thing, UK could do the same thing. China got stockpiles of it as well. So China can do the same thing. Anybody can do the same thing. So it's unfortunate that they keep these deadly things for bioterrorism, and they have them locked up in level 5 laboratories. So I was just told that Quebec actually have like 70 cases of the monkeypox, and they're starting to dish out the smallpox vaccine. So you see some places would be getting there. All right. So I'm going to close if we don't have one last burning question. All right, so Brother Doward, you could take your hand out, and I'm not seeing any more hands. So let us bow our heads and prayer to close this section. Dear Father, we'd like to thank you for the information that you have shared with us. We're asking you to bless those who have attended this session, help that the information may be relevant to them and they would benefit from it. Help, dear Father, that we may be as wise as serpents and harmless as doves, but help that we will understand the correct information and we may clearly divide your word as you share it with us, dear Father. Continue to bless, guide, and direct us now for Christ's sake.